Hello. Meningitis is the inflammation of the membranes that surround and protect your brain and spinal cord. It can be a very serious and life-threatening condition if it is not diagnosed and treated quickly. Meningitis is most commonly caused by a virus or bacteria. Viral meningitis is usually less serious than bacterial meningitis. Bacteria are tiny microscopic bugs. Meningococcus is one of the most serious and well-known bacteria that causes meningitis in the UK. Meningitis can affect anyone of any age. People who are most at risk are those aged 0 to 5 years, 15 to 24 years, and over 65 years. Having cancer or HIV also increases your risk. Meningitis can cause headaches, a high temperature and vomiting. Some people develop a stiff neck and can't bend their neck to look down at their feet. Other people find bright lights uncomfortable. Meningitis can sometimes cause seizures. Another possible sign of meningitis is a rash. This may start as tiny reddish-purple pinpricks, which then start to look like a bruise. Use the glass test to see if a rash may be due to meningitis. Press the side of a clear drinking glass firmly over the rash. If it does not fade, it may be meningitis. Babies and young children can develop similar problems. However, you may also notice that they have cold hands and feet, become irritable, are difficult to comfort, and won't stop crying. Breathe very fast, don't want to eat and drink, become very sleepy and feel floppy. Meningitis can develop quickly and can be life-threatening within hours. If you suspect meningitis, please seek medical help urgently. If a healthcare professional suspects meningitis, you must be admitted to hospital for blood tests and a lumbar puncture. This is when a thin needle is inserted into your spine to take a sample of the fluid that surrounds your spinal cord. You may also need a CT or MRI scan of your head. Bacterial meningitis is treated with antibiotics through a vein in your arm. Viral meningitis does not require antibiotics. Sometimes people with meningitis need to be admitted to the intensive care unit for close monitoring and support. If treatment is started early, most people make a good recovery. However, some people may be left with complications such as hearing loss, learning difficulties, epilepsy and kidney problems. All children are offered vaccinations to protect against some of the bugs that cause meningitis. It is highly recommended that all children have these vaccinations. The meningitis ACWY vaccination is recommended for young teenagers, sixth formers and freshers going to university. For more information about meningitis, speak to your GP.